Welcome to another episode of PT et al. We have Dr. Chris Fisher with us today. And as always, I'll be your host, Brian Payton. Hello, Chris. How are you?
Good, Brian. How are you?
Doing well, thanks. It's a long-time listener, first-time guest. You excited to be on here?
That's right. Absolutely. Absolutely.
All right. So Chris brought this article to my attention. He's been working with ACLs for quite a while now. And at his clinic and within his company, he's been kind of part of the ACL task force, so to speak. So the article that we are reviewing today is titled ACL Injury Prevention Training Results in Modification of Hip and Knee Mechanics During a Drop Landing Task. And that's by Christine Pollard et al. What drew your attention to this article?
Just to see if there's any new literature, really what's going on in terms of, the mechanics, looking at different strength, looking at different biomechanics in relation to landing and seeing if there's anything new out there in the literature and how it applies to where we're going with treatment of ACLs and as well as return to play with ACLs.
We were kind of talking before recording that this article in itself, I don't think neither of us necessarily had any groundbreaking revelations from it, but it's also good that it confirmed our previous thoughts. So just staying up to date with your current practice is always good as well. So another good article Chris brought to us today. So it's well known that young female athletes are more prone to ACL tears than, say, men. What we usually see during the landing from a jump is the knees buckling in, going into hip internal rotation, valgus knee angle, and that's shown to put a little bit more shear forces on the ACL in general. So we're looking at soccer, basketball, any type of running, whether it's softball or tennis as well. The authors of this article state that they hypothesize that if hip extensors are unable to adequately contribute to the deceleration of the body center of mass, females may compensate by relying more on the quadriceps and passive knee restraints in the frontal plane to absorb impact forces. So like we were just saying, the hip internal rotation and the valgus at the knees. Is this something that you see a lot, Chris?
Yeah, I mean, especially with, I know this article definitely focused on, female and bringing that to light just due to their mechanical makeup with a larger Q angle and wider hips and whatnot. But with most people returning from ACL, whether it, depending on how long it lasts for, you're going to see those mechanics with someone when they first try to return to any type of plyometric or sport specific. You could have a female who, was much, much stronger going in, and they just happened to have a contact ACL injury, right? Versus a non-contact. Okay, so you might have that non-contact person who was a male and really was not great. What was going on at the hips before that, which is what caused the injury, versus the contact female. And they may be at the same place, or the female may be a little bit more ahead when it's time to go into more plyometric type stuff with the rehabilitation. But in general, yeah, I mean, you're going to see much more of these mechanics and issues with the female athletes versus the male, just due to their general makeup.
And we're talking primarily about female athletes in this article, but like you mentioned, this is something to keep an eye out for male athletes. There is a phenomenal mixed martial artist, George St. Pierre, who was world champion, one of the best competitors ever. Whenever he won a fight, he would often do a backflip inside the cage, and his knees would always buckle in. And I always thought, like, for somebody that's so athletic and can do a backflip, his knees are always buckling in. I'm worried about his ACL, and lo and behold, years after he's been doing this, he had bilateral ACL tears on 2 different occasions, not at the same time. But yeah, so it can happen to anybody, but this article specifically is the young female athlete. I believe the average age for the subjects was 13 and a half years old. All were soccer players that they went through this training during their soccer season. The primary objective of the current study was to investigate whether an ACL injury prevention program that has been shown to reduce occurrence of ACL injuries in females by 70 a drop landing task. The first biomechanical testing session occurred within 2 weeks before the initiation of the training program, and the second testing session occurred within 2 weeks immediately after the completion of the training program. They had 8 cameras and force plates that they were testing these drop landings on with all the athletes and measuring the hip and knee moments and the what muscles were being used to absorb the impact. They used the Santa Monica ACL Injury Prevention Project, which I'll have a link below, and I'll put something on the screen right now to give you a little idea of what that involves. But the main points of that are to avoid vulnerable positions, increase flexibility, increase strength, include plyometric exercises into the training program, and increase proprioception throughout agilities. One thing I found interesting, I'm not sure if you looked into the Santa Monica program, but they do static stretching immediately before the workout, which I think is a little bit kind of out of date. More of like a dynamic, they do a dynamic warm up as well, but the static stretching I think should either be done hours before or hours after, just to allow for more force production within the muscles. So that was one little thing I saw.
Yeah.
But I'm not sure how old this program is or if it's been updated from what I saw.
I mean, I'm not sure when they updated that or if it's not updated. I know that that program has been out there for a long time. And I know that there has been efforts throughout the country, throughout the world, that everyone has tweaked their own program off of that. I'm not sure if that particular program that they have in this article is an updated one or if it's the original one. But yeah, I mean, I think, you know, you hit it on the head in terms of the static stretching. Like, static stretching is great, you know, for, you know, long-term tendonitis, overuse, you know, type injuries like that. But there is not 1 ounce of literature out there to demonstrate that static stretching is going to decrease an acute injury prevention.
Yeah, I'm guessing it was kind of tradition that it got folded into there. We had George Edelman on the podcast several weeks ago, who's one of the physical therapists for the United States swimming team. And he had developed a different type of dynamic warm-up that really avoided static stretching and said do it hours before, hours after practice or competition. So just another instance of where it's probably not the best to do that right before or after practice competition.
Yes.
Or even kind of training in that regard.
Right.
So the program is performed 2 times a week for 12 weeks during the course of the soccer season. The authors state that the post-training adjustment in behavior was best illustrated by the change in knee-hip extensor moment ratio and knee-hip energy absorption ratio. The changes resulted in a 25% reduction in knee-hip extensor moment ratio and 19% reduction in knee-hip energy absorption ratio. So I'd say those are pretty substantial numbers there.
Yeah. And if you look, you know, if you look at the, I don't know if you can put this in the link as well, but the image that they had in there from the before and after, with looking at the frontal and sagittal plane of the, especially the hip flexion, there, that makes a big difference in mechanical, you know, outcome and the landing of what's going on with the athlete.
Definitely. I'll put a picture of that over the screen here and leave a link to the article down below so everybody can go take a look at it if they want to. A likely explanation for the observed post-training moment behavior is the combination of increased hip strength and newly established movement pattern. So they didn't test strength before or after in this article, which I found interesting because it's not an elaborate test. They're only testing a few muscle groups. I know you have some thoughts on this, so I'm interested in hearing that, but I just wasn't sure why you would not test strength before and after to see if that has anything to do with those changes in moment arms.
Right. Yeah, I mean, I think for the purpose of this article, I think it would have been a good idea to have that information, just more data into the system. If you look at overall where ACL return to play guidelines are going, it's more based around function than strength. And I don't want to completely exclude the strength, right? Because we still are going to look at isokinetic hamstring versus quad, and that this article definitely focused around that, right? So like definitely applicable. But we're looking at more things like a hop test, a lower extremity scoring system test, which it falls back to a drop jump, which is exactly what they were doing in this article here, right? So I don't think it's like completely obscure that they didn't. However, I think it would have been nice to have that data, especially given that they're looking at hamstring and quad versus like hip abductor external rotation, and how that really applies into the literature with strength ratios and function.
Yep. Dr. Steve Pete and I a couple weeks ago talked about a sprinting protocol for return from knee injury, predominantly focusing on ACL injury or repairs. And you've got to reach strength ratios, hamstring quadriceps. You have to perform properly in terms of percentages of the non-injured leg in your hop tests, and get through a jogging program as well. So definitely you want to keep an eye on function. It's a whole big picture. You're not looking at just
Right.
one thing to check the box of and then progress to something else. It's a big picture you have to look at, and
Right.
especially with the individual as well as the sport that they're returning to.
Yes.
So, Chris, we mentioned how you're in the ACL task force at your place of employment. Can you tell us a little bit about where you mentioned that you're looking at function, but is there anything else that we can look forward to in what's on the horizon of ACL treatments and return to sport?
Yeah, that's a great question, Brian. I think that we're definitely looking at and revolving around more function than looking at vascularization of the graft. That the vascularization thought is starting to become more archaic, where that we don't reach 80-90% of vascularization until 12 months, and we don't even get all the way close to 100% until 24 months. We're starting to see that that's not really important in terms of what's happening with the athlete. So I think focusing more around mechanics, focusing more around strength ratios, and watching how that athlete is actually able to perform on one side versus the non-effective side is really where we're going in terms of treatment and in terms of return to play.
I mean, again, we can point to Adrian Peterson, who made an astonishingly quick comeback for those times. And I can't remember what year that was, but it's got to be 6-7 years ago, towards ACL towards the end of the season, came back the following season, had one of the best seasons of his career. And that he's a extraordinary athlete who we shouldn't kind of make him the guiding light there in terms
Right,
of
right.
what to follow, what everybody can meet, but it is possible to go off function rather than wait for that 12 months of vascularization to occur, like you mentioned. Anything else you'd like to say, Chris?
No, I think this was great. It was fun. Thanks for having me on.
Yeah,
Looking forward to seeing it posted, and looking forward to other podcasts coming out from other colleagues.
absolutely. Well, thanks for coming on, Chris.
Thank you.
We'll talk soon.
Sounds good.